I think some of what going to say has already been said. I think the couple of key factors to keep in mind are be aware that there are other causes of peripheral neuropathy, and for those individuals who are suffering from things like diabetes or vitamin B12 deficiency, which can result in a peripheral neuropathy, to make sure that those conditions are really well controlled when you start your chemotherapy, so that there's less chance of aggravating the situation. As both my colleagues said, to know what it is that you're looking for and to be aware of those signs and symptoms and to be really attuned to what's happening while you're getting chemotherapy is really important. On every visit with your oncologist and your nurse, certainly to speak to the side effects of the treatment that you're having so that alterations in the treatment plan can be made accordingly to each individual. I can't say how important it is to be informed and to ask questions. Continue asking the questions until you have an answer that's satisfactory. In terms of the practicalities, some of the things that nurses would advise their patients, make sure that the rooms in which you are living are well lit so that people are not going to stumble and fall over things. You can easily see where you're going. Be sure that there are non-skid surfaces on the bathtub or the shower, whatever, if you've had difficulty with your feet and feeling things. Make sure the floor and the hallways, things like that, are clear of clutter if you have difficulty with balance and finding your center of gravity. As is already mentioned, to make sure that you wear the appropriate clothing for the weather, particularly going out in the cold. In terms of being in the kitchen, remembering to do things like check the temperature of the hot water before you put your hands under it. Make sure to use pot holders and make sure you use the handle of pots and those sorts of things, because you may have impairment of the sensation in your hand. It's always a good idea to have the hot water boiler in your house turned down a little bit if you have any impairment in your sensation at all, to avoid burns. Wearing gloves when you're gardening or doing any outside work, anything like that will protect your hands, doing dishes, those kinds of things. Sometimes we get distracted when we're doing things. Trying to stay focused on a task will sometimes avoid injury, particularly if you have any impaired sensation of your hands or your feet. Visual cues are helpful. For women who have peripheral neuropathy of their feet, particularly, sometimes they don't exactly know where their feet are. So using visual cues when you're walking, particularly if people are walking outside or hiking, that kind of thing, to know where your feet are is helpful. Wearing well-fitted, comfortable shoes helps to give people a better sense of balance and also, again, helps to avoid injury. Something we don't talk about very much but really struck me when I was sort of doing some new review for this presentation was being careful when you're driving the car or operating any sort of a vehicle, because if you have impaired sensation in your hands or your feet, you may not be able to judge the gas pedal or the brake the same way, or you may not be able to grip the steering wheel the same way, which I have to say I really hadn't thought about that. But I guess it's a reality for the women living with this problem. Another thing people should do is check your skin for any breaks or abrasions, particularly around the hands or the feet if you're not able to feel it properly. Particularly when on chemotherapy, it can be a source of entry for infection, so you want to be careful of that. In severe cases, certainly the assistance of our colleagues in occupational therapy may be of assistance, or in physiotherapy. We certainly don't see that degree of severity in our practice, but I'm sure there are people who do that. In terms of things that you can do, exercise, there is some research to indicate that exercise is helpful. Just even passive range of motion exercise, putting your joints through their normal range of motion, is believed to have some benefit in helping to regenerate the nerve supply there. And it seems to have some therapeutic value. There's some ongoing evidence there. Strengthening exercises are helpful in helping to decrease motor deficits related to the peripheral neuropathy. It also helps to improve circulation, and it also helps to improve balance. So that may be beneficial. Relaxation techniques, whether that's deep breathing, yoga, meditation, imagery, whatever works for the individual, can reduce the muscle tension that people experience, and by doing so helps to diminish the pain that some people experience with their neuropathy. Massage therapy can be helpful. It can certainly improve circulation, promotes relaxation, creates a feeling of well-being, can relieve muscle stiffness, those kinds of things. However, with those individuals who experience a hypersensitivity related to the neuropathy rather than a decreased sensitivity, you would want to be careful in using things like massage because it may actually aggravate. So that's very dependent on the individual. There is some research to show that TINS, or the transcutaneous electrical nerve stimulation, may be helpful. And what that does is it will block the conduction of the nerve signals going to the brain through electrical impulses. It's a safe procedure. It's painless. It is believed to increase the release of endorphins and thereby blocking the sensory stimulation through distraction. So that may be helpful for some people. Hydrotherapy, or exercising in water, has been found by some individuals to be helpful, partly based on the buoyancy of being able to exercise in water, and partly based on the relaxation benefit of being in the water. So those things may be helpful. There is some report in the literature of people finding acupuncture and therapeutic magnets beneficial, but there's no medical evidence to support that, although there are people with anecdotal evidence that they have found it helpful. So I guess in cluing up, just to sort of say some of the challenges that we face in trying to deal with the issues surrounding peripheral neuropathy is that we really don't clearly understand the cause or the pathogenesis behind what's happening, so we're still working to figure that out. There really is no good, sound, evidence-based therapies that we know of to alleviate, although there is some research being done in those areas. The other stumbling block that you read about all the time in the literature is that as healthcare providers, we're not very good at consistently assessing patients in a systematic way to try and figure out what the symptom is. And I think that's partly due in the past that we were so concentrated on trying to deal with the side effects of chemotherapy, like people getting terrible infections or nausea or vomiting, that was where the emphasis of the research was. Now that those things are much better, I think we're moving towards looking at other side effects like the peripheral neuropathy. And so it's becoming much more to the forefront in trying to find information that will be helpful to people and live in their lives.